A chipped tooth is more than just a cosmetic issue when it's starting to cause sensitivity, when it's inhibiting a person's everyday life functions, such as eating, drinking, when there's a change in your normal behavior of your day and you're being limited for your full potential, then at that point, a chipped tooth is not just a chipped tooth. Something needs to happen. There needs to be consideration for repair, how to get better. Furthermore, aesthetically, it can be hindering in regards to someone's confidence. They might have an inability to smile. They might not feel as confident in a work setting, school setting. So, being able to get your chipped tooth repaired is essential not only cosmetically, but also functionally in regards to eating and living a healthy lifestyle. Some of the most common ways we notice people will chip their teeth are with if they are chewing on things that they're not supposed to, so like on nuts that are harder, or maybe they the way their teeth are aligned, if they're not aligned correctly, chipping can occur that way as well. Um, Chipping can also occur just as an accident, like if you take a bite into like your spoon on accident or your fork. So those are just different ways that people can chip their teeth. Also, a chipped tooth can also occur with sports. If you're playing softball or baseball, or you're wrestling and you get like an elbow to the face, you might get a chipped tooth that way as well. So when someone comes in and they have a chipped tooth, we determine if bonding or veneers are necessary, depending on the amount of tooth structure that has been lost. Also, being able to talk to the patient, seeing what their ultimate goal is essential, because some patients might prefer one product over another. Aesthetically, they might be trying to fix all front teeth, and if that's the case, then maybe veneers are more appropriate. Composite might be something that we use if it's very minute. Also, if we're trying to think cost effectively or efficiently, composites might be more of a route to go towards, where veneers are a little pricier. So being able to talk to the patient, see what they're looking at, see what their financial status is at that moment, will also help us determine what route to go. A chipped tooth can definitely be a sign of a bigger problem. So if teeth aren't aligned properly, similar to the misalignment of car tires, the tires will wear at a different rate, and our jaw and our teeth wear the same way. If our teeth are not aligned in the best position possible, then our teeth will wear in different rates, and it could lead to chipping and fracturing of the teeth. So yeah, having your teeth aligned is definitely key in regards to trying to keep your teeth for as long as possible and preventing any chippings from occurring. Bonding and veneers, longevity and cost. So veneers are usually more costly. They do have a longer durability, and they look aesthetically more pleasing. If we're going to do a veneer, it's usually recommended that you do more than just one front tooth so that they all match cohesively and that they get done at the same time, because the lab at that time will use the same color, the same material, the same hue, and they will make them match perfectly. With composite, it is less expensive. It can vary in how it lasts, especially for chipping. It's probably like a tip of a tooth somewhere, and so it's probably a little more fragile. And it just depends on how the bite is. If there's already a chipped tooth based on the bite being off, it's more than likely that that chipping will occur again, based on that the root of the issue is the alignment of the teeth. And if that doesn't get resolved, then chipping can occur again. So there's no real knowing how long that will last. Repairing a chipped tooth can be life-changing to many people. So this can interfere with your everyday confidence with work, with school, with your kids. We've had many stories of patients coming in that they're embarrassed because their kids will call them out like, oh, what's wrong with your tooth? And kids are very honest without them even knowing that they're maybe hurtful to the person, but they'll call out what they see. And they're like, hey, what's wrong with your tooth? And Someone might be limited in the way that they smile, the way that they speak, the way that they interact with others. And that could be limiting in regards to like getting a raise at work, advancing in their careers, advancing in their home life. I mean, that can affect even a dating life. So being able to fix a chipped tooth can have major effects in someone's life. Something that we want patients to know in regards to repairing a chipped tooth and not just going somewhere that is inexpensive or even doing something at home is that they could possibly be causing a bigger issue. So if you're putting in some sort of material and like trying to create a quick shortcut fix for the chipped tooth, it can create bigger problems down the line. It could interfere with the structure of the tooth. It can just create issues that might not be helpful down the line if you do it the right way.